Hi, my name is Shavinder Kakkar. I'm an F&B student at Maryville University. Today I'm going to do a head-to-toe assessment on my volunteer, Mr. Kakkar, and I am going, his vital signs and his height and weight have been taken. He's been instructed to empty his bladder, change his clothing into a gown. His distant vision has been checked via the Snellen chart. His near vision has been checked, the Rosenbaum chart, and I'm going to start my assessment with an overall general assessment of his general appearance. He is a well-formed 35-year-old male. He does not appear to be in any distress. His speech is clear. He's alert and oriented times 4. He is appropriate for the situation, and I'm next going to move my assessment to his head and his facial area. I'm going to visually inspect the head and face. Head is normocephalic and his facial features are very symmetrical. I am next going to palpate the head while feeling the texture of the hair. I'm seeing that his scalp bones are freely movable. There are no masses, no lesions. He does have a receding hairline. Next, I'm going to palpate his facial bones and his facial muscles, feeling for any masses or any tenderness. Next, I'm going to palpate the frontal sinuses, feeling for any tenderness or any fluid buildup, palpating his maxillary sinuses. Okay, those are free from tenderness. Next, I am going to check his temporomandibular joint. I'm going to place my hands on either side of the temporomandibular joint. Go ahead and open your mouth. Okay, move it side to side. Okay. When checking for the TMJ joint, I am checking that it is freely movable and it's free from any pain or tenderness. And TMG is normal. And next I am going to check the sensation around his face. Okay.
Forehead,
Okay.
left cheek,
Okay.
right cheek,
Okay.
nose.
Okay, so that was checking for cranial nerve number 2, and that is also intact. Next, I am going to check the facial nerve, which is the nerve number 7. I want you to open your mouth. Okay, stick your tongue out. Okay, close your mouth. Okay, close your eyes. Okay, close them tight. Okay, open them wide. Okay, and wrinkle your forehead. Okay, all right. So that was checking for cranial nerve number 7, and it is also intact. Next, I am going to do an inspection of his nose. From the outside, I'm going to visually inspect the nose to see if there's any bumps on the nose, if there's any abnormalities in formation of the nose. The nose is symmetrical. Next, I am going to palpate the nose, feeling for any masses, feeling for any bone spurs or bone growths at the base of the nose. And now I'm going to look on the inside of the nose. Okay, the turbinates are clear. There is no nasal discharge. Nasal mucosa is slightly pink, and there does not appear to be any nasal septum deviation. I am going to check the patency of the nose. I need you to close one nostril, breathe in. Okay, close the other nostril and breathe in. Okay. Patency is equal on both sides, and next I'm going to check his sense of smell, which is checking for cranial number 1. Can you smell this?
Yes, sour.
Okay, lemon. Okay.
It's like sweet.
Okay.
It's kind of guava.
Okay. All right. So his the cranial nerve number 1 is intact. Next, I am going to assess the eyes. I'm going to visually inspect the eyes. The eyes are symmetrical on his face. The eyebrows are very symmetrical. The eyelashes are turned upward and outward. There is no discharge. There's no redness of the eyes. There are no signs of irritation or infection. I am going to look at the conjunctiva. It is pink in color. The sclera is not yellow. There's no signs of jaundice. There are no signs of infection. And while at the eyes, I'm also going to check his pupillary response to light. I'm going to check the accommodation, and okay.
Ready?
Okay. I'm going to shine light from this side. Okay. Both pupils are equal in size and equally reactive to light, and they both accommodated. So that was checking for cranial nerve number 3, and that nerve is also intact. And next, I am going to check the cardinal fields of gaze. I'm going to check for any extraocular movements. I'm going to check his visual fields. I want you to tell me when you see my hand.
Right here.
Okay.
Right here.
Okay.
Right here.
Okay.
Right can see.
Okay. I want you to follow this light just with your eyes. Okay. 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 All right. So that was checking for cranial nerve number 2, 3, 4, and 6, and those nerves are also intact. Now I'm going to do a cover and uncover test. Can you cover one eye for me? Okay. Okay. Cover the other eye. Okay. Okay. So while doing the cover and uncover test, I'm trying to see that the both eyes, the movements are symmetrical, and that there is no drooping, there's no ptosis, there's no lazy eye. Okay. Next, I am going to do an inspection of his ears, and for the ears, first I'm going to look at the ears. Okay. The ears are symmetrical. And I'm looking at the external ear. I'm looking at the pinna. It looks normally formed. Next, I am going to palpate both ears. Okay. Feeling for any masses, feeling for any lesions, any change in texture of the skin. Next, I'm also going to look behind the ears, looking for any skin issues, looking for masses, lesions. Okay. Next, I am going to inspect the inside of the ear with an otoscope. Okay. Okay, the ear canal does have some wax in it. The membrane is pearly white in color. There is no discharge. Good light reflex. There is no scarring. There's no perforation of the tympanic membrane. And next, after the ears, I am going to inspect the mouth. With the mouth, I'm looking at the lips. Lips are not dry. There are no visual lesions. There are no masses. I am going to look on the inside of the mouth, noticing the color of the mucous membranes. They're pink and moist. He does have good dentation. No visual caries. Soft and hard palate. The uvula is midline. Tonsils are present, free from any redness or discharge. I'm also going to check his mouth, the gag reflex. I'm also going to check for the gag reflex, and okay, the gag reflex is present, and that's checking for cranial nerve number 9, and that nerve is also intact. Next, I'm going to move my assessment to the neck area. First, I'm going to visually inspect the neck, and then I'm going to palpate the neck, feeling for any masses, feeling for any lesions, checking the skin to see if there's any color changes, if there's any irritation. And then next I am going to feel his trachea. Trachea is midline. Going to palpate the thyroid. Okay. It's not enlarged. Can you swallow for me? Okay. All right, the thyroid is not enlarged. I am also, while I'm here, I'm going to feel for his carotid pulses on both sides. Okay. 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 And I'm also going to check the lymph nodes. I'm also going to palpate the lymph nodes. I'm going to start with the pre-auricular. Okay. Post-auricular. Okay. Submaxillary. Submental, submandibular, occipital, cervical chain, deep cervical, supraclavicular, infraclavicular. Going to also palpate the axillary lymph nodes. And while I'm palpating these lymph nodes, I am feeling for any masses, I'm feeling for any enlargement, any lymphadenopathy, and none of that was present. And at the neck, I'm also going to check JVD, jugular venous distension. I am ideally to do this, the patient should be in 45-degree angle. I'm going to have him slightly turn his neck to the left. And I am looking for any visual pulsation. He does not, the JVD is not present, it's absent. So since that's not a concern, I am not going to measure the JVP pressure for this patient. Okay. Next, I am going to check the range of motion in his neck. I want you to do this. Okay. Neck back. Okay. side, left side, okay, right side, okay, okay. He does have good range of motion in his neck. I am going to do the Weber's test. And to do the Weber's test, a tuning fork is needed, so I'm going to hold it from the base, slightly tap the tuning fork, place it in the middle of the head. He should hear it on both sides. Do you hear this on both sides?
Yes.
Okay. And then again, I'm going to take the fork and put it behind his ear at the mastoid bone. Okay. Tell me when you stop hearing that.
Yeah.
Okay. Now I'm going to keep it 2 centimeters from his ear, and tell me when you stop hearing the vibration.
Yep.
Okay, so doing that, we're supposed to time the for the Renee's test. Air conduction is longer than the bone conduction, so AC is greater than BC, and it's also true for Mr. Kakkar. Okay. Now I am going to do the shrug test. I need you to shrug your shoulders like this. Okay. Shrug them against resistance. Shrug again. Okay. So that was checking for cranial nerve number 11, and that is also intact. Okay. Next, I am going to do the assessment of his upper extremities. Okay. Okay. I am looking at his nails, looking for checking capillary refill. Okay. Checking for any clubbing of the nails, checking for any deformities. All those are negative. Going to check his radial pulses on both sides. Feeling for rate, rhythm, and intensity. Brachial pulses, again, rate, rhythm, and intensity. Okay. 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 I want you to lift your arm. Okay. Okay. I'm going to try to push your arm up and keep me from pushing it up. Okay. All right. He does have good strength. Do the same. I'm going to try to push it down and keep me from pushing it down. Okay. Okay. He does have good strength. Okay. 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 So he's got very good strength in both upper extremities. I want you to open and close. Okay. I want you to do this. Okay. That. Okay. That was checking for range of motion in his wrist, and that's very good. Okay. Next, I am going to do a assessment of the chest. And first, I'm going to visually inspect the chest. I'm looking at the shape of the chest. Transverse diameter is greater than the AP diameter. I'm also looking for any visual deformities on the chest. I'm noticing the color. He does have a very even color. There's no cyanosis. There are no visual lesions. Looking for any deformities of the chest wall. Okay. I'm also noticing his respiratory effort. I am looking for the use of any accessory muscles, which he's not using accessory muscles. His respiration is unlabored. He does have expansion of the thorax is equal on both sides. Next, I'm going to do the palpation. I'm going to palpate the anterior chest, feeling for any lesions, any tenderness. Okay. 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 I am also, while I'm palpating, I am going to check the tactile firmitas. Okay. I want you to say 99.
99.
Okay. 99.
99.
Okay.
99.
Okay. All right. So next, I am going to auscultate the chest area. I'm sorry. I'm going to do the percussion on the chest, and I'm going to move from side to side so that I am comparing bases on both sides. Okay. On percussion, I'm feeling for resonance. Normal sounds or resonance. I am also feeling for any dullness, any hyperresonance. Those are not expected sounds. The percussion sounds are great. Resonance, and I am next going to auscultate the chest area. I'm auscultating his lung sounds. Okay. Lungs are clear. There are no crackles, no rhonchi, no abnormal lung sounds. Now I am going to move to the posterior chest. I'm going to have you turn to the side. Again on the back area.